Some of Canada's largest health advocacy groups are urging the federal government to take action on vaping. Here's what they want: for Ottawa to put the same restrictions on e-cigarettes as there are on tobacco. The call comes a day after health officials in London, Ontario, confirmed the first case of vaping-related illness in Canada. We've got CBC's Vicadopia on this story. So the health group's making no bones about it. What are they calling for?
Well, they're saying vaping is youth vaping is a public health crisis, and they want a ban on three things immediately. The first is all advertising for vaping products. The second is those flavors that they say are enticing to young people, the watermelon and fruity flavors. And the third thing is high nicotine vape e-juice, or the vape product that goes in the dispenser, so which is getting people addicted. So what they're saying, this includes the Canadian Medical Association, the Cancer Society, Heart and Stroke, is that yes, vaping may not be as harmful as smoking, but that doesn't mean it is without harm. And this is what the Canadian Medical Association had to say.
There are definite health risks associated with vaping. It can lead to addiction. Right, it can be a gateway drug for nicotine. Some of the other health consequences include of vaping include the adverse effects on brain development, particularly in youth, on pregnancy. It does have risk of cardiovascular disease. It does have risk of lung disease.
So what we're hearing from Dr. Buckman is, we don't need to reinvent the wheel here. Just treat it like tobacco, and then, do these three things. And, Health Canada has been doing consultations. The provinces have all said, we need to scale back the advertising. They are not completely agreed on what level of advertising, but they're saying these are things that they want the federal parties to agree to. Impose an interim ban after the election, come back, put in the legislation, but act now because it is a crisis.
And what about those people who say vaping is helping them to quit smoking? Almost as if, it's the lesser of two bads. Yeah,
I mean, that is, for example, the Canadian Vaping Association, there are different views on this. One is that, it does have a legitimate use for smoking cessation. It's not better than cigarettes necessarily. It does come with certain harms. But at the same time, the evidence about how effective it is actually pretty weak. And, the fact that we're allowing really high nicotine e-juice in these vapes means that people are just getting addicted. And this is what one anti-tobacco group from Quebec had to say about using this as a smoking cessation tool.
In terms of the nicotine content, 20 milligrams per milliliter is the European directive. It's been enforced now for a number of years. One of the most promising clinic random trial in terms of cessation for vaping products used a dose that was 18 milligram per milliliter. And so it's quite obvious that we don't need these very high doses.
So that is the problem. It could be a smoking cessation tool, but the evidence is weak. It is a lower level of nicotine that's working, but so why do we need these really high nicotine products on the market? It's just getting people hooked, and especially young people. It's making them vulnerable.
I don't think this story is going away. Thank you, Vic. CBC's Vicadopia.